Hi guys, I am back with another video on talking about the flu. Flu season is almost here. It starts anywhere from August all the way until April the next year. It takes a very long time. It's caused by a virus. So you can use antivirals to treat the flu, but you can't use antibiotics to treat the flu because it is a virus. So we are in influenza season. Some of them are worse than others. It just depends on the year. So take care of yourselves, take your vitamin C, sleep well, rest well so we can avoid the flu. I have a few questions here where I was given to follow. So if I look on the side, I'm looking at my footnotes to make sure that I cover everything concerning the flu, because flu season is upon us. And now the flu gets mixed up with COVID and cold symptoms and everything else. So it's important to know what is the flu, what are the signs and symptoms of the flu, when are people contagious with the flu, when is it worse, who does it affect more, so that we are cautious of ourselves as we get along into this season. So what is influenza? Influenza is a contagious respiratory illness that affects us mostly in the fall season. Rarely in the warmer months do you get flu symptoms. So it's contagious. You can get it from anybody. It's spread by droplet precautions, meaning if you're next to somebody and they have the flu and they sneeze and you're within so many feet, you can get it. So it's important, if you have the flu, sneeze in your elbow or somewhere to avoid spreading it to other people, It's manageable, but some people can get really, really sick from it. So it's important to be able to differentiate. Is this a common cold or is this influenza? Because common cold and influenza are different. The symptoms actually overlap. So it's important to know which is which. You can prevent it by getting the flu shot. You can prevent it by getting the flu shot. You may get it still. It will just be a milder version of it. But you can prevent it by getting the flu shot or sleeping well, eating well, exercising. Most people who sleep, eat, exercise well don't usually get most of the diseases or respiratory viral illnesses that most people get. If they do, a regular person will get it 3 times a year. Healthy person, sleeping well, eating well, may get it once a year or never get it again. Never get it at all. So it just depends on how well you take care of yourself. Signs and symptoms: fevers, chills, cough, sneezing, sore throat, body aches, headaches. Those are the main signs and symptoms of runny nose is one of them. Congestion is another one. So those are the main symptoms of influenza. I'm thinking if I went through all of them: fever, cough, sore throat, chills, body aches, sneezing, runny nose, headache, body aches. Those are the main symptoms that commonly most people will get that. You may get all of them that I've mentioned and you may not get all of them that I've mentioned. It just depends. It just depends. And then also the severity of the flu. When it's so severe, you can get all the symptoms I've mentioned. And when it's not that severe, you get a few of them and you get better and you get away with it. Okay. How does the flu spread? I talked about that. When you sneeze, it's droplet. So anytime you sneeze, cough around somebody and you don't cover up, then the other person is at risk of getting the same flu. And that is why you see children get it so much more than middle age or than the other counterparts in the other age groups, because children play together, don't know about droplet precautions, don't know about all those, the fit distance that we need to keep to avoid spreading to other people. Children don't know that. So when they get it in masses. So and truth to be told, it affects children and patients 65 years and older worse than it affects middle category. So middle age children get it worse, older people get it worse. It's just the way it is. It spreads. Wash your hands, wash your hands, wash your hands. Sneeze into your elbow. If you're around people, excuse yourself so you're not sneezing and they don't have to get it. Okay. Who's most likely to get sick with the flu? Children and older people. It's just always been like that. Children play together. Older people are more at risk to get whatever kind of diseases. They get it more than anybody else does. So those are the main two groups, the children and the older people, most likely to get the flu or whatever respiratory issue is going on that year. Those are just the two groups that it gets. How is seasonal incidence of flu? It just depends. Some seasons are mild and people are able to manage, and then there's a year that the flu is so bad. And there are two types of flu. There's type A and type B. So there's a year type B is so severe, and there's a year type A is so severe, and there's a year the flu is just bad. You know, people are getting sick, people are staying home. So it depends on the year. The incidences differ from year to year. So whichever it is, if it's A or it's B, some people will have A, it will put them down, and some people will have B and it will put them down. It just depends on an individual's body. But the best way is fluids, rest, take your vitamin C's. The people who take emergency C, the oranges and everything to help, combat it is a good way to go. It sometimes reduces the symptoms and you can get the cold, but it won't be as severe. It won't put you down. And there are people who get the flu and it puts them down. It's just different years, different severity. Period of contagiousness. So if you're with somebody who has just gotten the flu, you're more likely to get it within the first 3 to 4 days of the person having the flu, if you're around them at that time. If you don't know that they have the flu, or they don't know that they have the flu, then that's hard. But if they have the flu within the first 3 to 4 days, then very contagious. Very contagious. You're more likely to get it at that time. Other healthy adults may be able to infect others before the symptoms come out. They do have it, but the symptoms are not full-blown. Those can affect you also. So that's one thing to keep in mind. It's another thing that the person is sneezing and you can see. It's another thing that the person is pretty healthy, feeling like flu symptoms, hasn't got it fully, but gives it to you. They can still give it to you. Children with weakened immune systems may be able to infect others without them knowing, just because their immune system is not so strong. So that's one thing to keep in mind. If you have a child with a weakened immune system, it's important to try and keep them as healthy as possibly as you can. If they are a regular child, they will get the colds more than any other population because that's what they do. But if it's a child with a weakened immune system, it's important that you take better care of them during this season of the flu so that they remain healthy as possibly as they can. Complications of the flu can cause bacterial pneumonia. It can cause you to be hospitalized during the very bad flu season. There are bad flus that people have to end up in the hospital. It can cause you to be hospitalized and require oxygen and be intubated. So take care. If you can get a flu shot, get a flu shot. There are people who can't get it for religious reasons. There are people who can't get it because they don't like how the flu shot makes them. But if you're healthy and you're able to get a flu shot, then get a flu shot. It will minimize those symptoms. Not saying you won't get the flu. You may still get it. The severity will be less. So it's important that you get it. Some people get congestive heart failure from worsening flu. Asthma usually worsens. Another disease is COPD. Those people, their symptoms usually worsen when they have the flu. Diabetes. Anybody with long-term chronic illness is at risk of worsening symptoms with the flu, unfortunately. So take care of yourselves, keep yourselves healthy, wash your hands. We talked about anybody can get the flu, but kids and older people are at a higher risk of getting the flu. It can happen at any age, but those are the two main ones. Those are the two main extremes: children, older people. Middle age will still get it, but we won't get it as severe as these two groups. This extreme stack of groups will get it. Diagnosing the flu. It is hard to diagnose the flu. Sometimes you think it's a cold and it's not a cold. So there is a test for it that you can go. They will swab your nose and they can tell you if you have the flu. If that is negative, then you probably have a cold. And there are colds that are so severe that you think it is the flu. But at least if you've ruled it out by testing, then you're sure that it's not the flu. But you do get colds that are so severe that you think you have the flu, you have the fatigue, you have the body aches, the chills and everything, but the test is negative. So that's a way of differentiating the two by having the test done. Test will sure tell you, oh yeah, this is the flu. But if the test is negative, then you know that it's just a bad cold symptom that you have, which some cold symptoms are bad. They make you not want to do anything, fatigue, resting. All you want to do is drink fluids and rest. So those are the two. How do you treat the flu? I talked about it. It doesn't need antibiotics as everybody thinks. It's a flu, it's a virus. All it needs is an antiviral. And depending on the time, if you've had it for a week and you want to treat it, you can take the medication. There's nothing much the medication is going to do for you. It's easier to take the medication within the first few days, really, because it's more effective at that time. But if you've had it for a week and then you take the antivirals, the truth of the matter is you probably will get better without taking the antivirals. So it's important to take the antivirals at the beginning. As soon as you are diagnosed, within those 28 to 72 hours, that's the best time to take the antivirals. But if you've had the flu for a week, no need. You can, if it gives you an effect of you're feeling better, but it is much more effective during the first 24 to 72 hours of you having the flu. Main thing about it is lots of rest, lots of fluids, good hand washing during this season. It's a long season. It takes about 6 total months. But if we take lots of fluids, rest, for the ones who believe in emergency, their vitamin C supplements, all that, take that, boost yourself, take the flu shot if you can, so that when you do get the symptoms, they are not as severe as when you didn't have the flu shot. There are people who do not take the flu shot, and when the flu comes, they are able to handle it just fine. So whatever it is, I know if you're in healthcare, it's easier for you to get the flu shot because you're working around patients and it just protects you, because how many patients do you get in touch with in a day between those months of flu season? So let's take care of ourselves, good rest, good sleep, and you guys have a great week. Take care. Bye-bye.